Today, we have Dr. Deborah, who is our reproductive endocrinologist in Austin, one of our newest clinics here with us. And we have Krizsta, who is one of our nutritionalist providers who specialize in PCOS. So we're so happy to have you guys both here. Welcome, everyone. And Dr. Deborah, you can take it over from here.
Yeah, hi everyone. My name is Dr. Deborah, or Dr. Deborah. I'm Deborah Ikhena-Abel, and I'm so happy to be here today to talk to you about PCOS and also about Kindbody. So Kindbody is on a mission to make reproductive health and fertility care more accessible to everyone. And so our goal is really to make sure that no one feels left behind on their fertility journey. So for today's talk, I am going to go over what is PCOS, how does it affect fertility, do all women with PCOS need fertility treatment to conceive? That's a common question that I get. I'm also going to talk about what fertility treatments are available for women with PCOS and what are the non-fertility effects of PCOS and how those can be managed. And then Krizsta, our nutritionist, is also going to talk about diet and lifestyle options for managing PCOS. So PCOS is extremely common. It is the most common cause of irregular periods worldwide, as well as in the US, and 1 in 10 women is affected by PCOS. It is diagnosed using the Rotterdam criteria, and it's a pretty clear-cut diagnosis. People always ask, how, do I know for sure that I have PCOS? And the way we know for sure is if you meet 2 out of 3 of these criteria, that is irregular cycles, hyperandrogenism, which basically means high male hormone levels, specifically testosterone, or if you have acne or male pattern hair growth, which we call hirsutism. And the third criteria is polycystic appearing ovaries. So those 3 criteria are the ways that we diagnose PCOS. And so how do we diagnose PCOS in the office? The first thing we do is we take a detailed history. We want to understand if you have irregular cycles or hyperandrogenism and how long you've had those irregular cycles for, and what exactly is the pattern of irregularity. That's very important in kind of looking at PCOS. We also will then do blood tests. We check a testosterone level because that is the androgen that can be elevated in PCOS. But we also rule out other possible causes of irregular cycles and or hirsutism. So we check your thyroid, we screen for diabetes, we do a hormone test for something called congenital adrenal hyperplasia. Someone had a question about hypothalamic amenorrhea. And so in this setting, we would also check, FSH, we'll check estradiol, LH. All of those things help us to ensure that this is not caused by something else and that it is truly due to PCOS. And we also do an ultrasound to look at the ovaries to see if they look like polycystic appearing ovaries. And I'll talk about what that is on the next slide. So one of the common misconceptions with polycystic ovary syndrome is that they have cysts on the ovary. And actually it's a misnomer, it's a bad name because women with PCOS don't actually have cysts. So if you look at the image on the left side of the screen, you see a large, clear black bubble in the center, that is a cyst. If you look to the top left corner of that bubble, there are 2 smaller bubbles, which are follicles. Now, when you look at the ovary on the right side, there are a bunch of those smaller follicles. That's a PCOS ovary or PCO appearing ovary. There are a bunch of follicles. If you have greater than 12 follicles on each ovary, that is consistent with PCOS. Okay, and so women with PCOS do not have cysts on their ovaries. They have a ton of follicles. So how does PCOS affect fertility? Now, each one of those follicles has an egg in it. And what should happen over the course of a cycle is that about halfway through the cycle, one of those eggs, which has been growing gradually over the first 2 weeks of the cycle, one of those follicles will then release an egg. And that egg should be mature and then can get fertilized and result in a pregnancy. Now, with PCOS, what happens is you do not have that growth and development of the egg. And so all through the cycle, those follicles stay nice and small and you don't have any egg released. So there's nothing for the sperm to fertilize and pregnancy is not able to occur. Now, do all women with PCOS need fertility treatments to conceive? The answer is no, they don't all need fertility treatment to conceive. There are some women with PCOS who will ovulate frequently enough on their own that they are able to monitor ovulation with an ovulation predictor kit and time intercourse based on the results of the ovulation predictor kit. However, you have to keep in mind that in women with PCOS, sometimes these ovulation predictor kits can be unreliable because there are some women with PCOS who have elevated levels of the hormone that these kits measure. So an ovulation predictor kit checks for a hormone called LH, and that is the hormone that our body releases to trigger ovulation. It should increase and decrease about 24 hours before ovulation. But in women with PCOS, sometimes, not in all women with PCOS, but sometimes LH is always elevated. And so if you're one of those women, using an ovulation predictor kit will not be useful because you're never going to have that change that you should see that would indicate ovulation. The other thing I like to point out here is using ovulation tracking apps are not accurate for PCOS because those apps are assuming that you have a 28-day cycle. And so if you have PCOS, ovulation apps are not going to work, but sometimes ovulation predictor kits may work depending on the nature of your symptoms. And so, like I mentioned, okay, so we talked about that already. So the next thing is, what are the fertility treatment options that are available for women with PCOS? So assuming that you're not able to track ovulation on your own, or you've been trying to track it but have been unsuccessful, or have been trying for over a year with PCOS and have not conceived, then the next step is really to move on to fertility treatments. And the first step is to induce ovulation, or as we call it, ovulation induction. So if you go back to what I mentioned earlier, one of the main issues with PCOS is that you're not ovulating. You're not growing a follicle and releasing the follicle. And so the first step in treating this is to then grow the follicle and release the follicle. And the medications we give to induce growth and ovulation are Femara or Clomid. And we usually will decide between those two based on the fact that studies show that most women will do better on Femara. So typically, Femara is our first go-to, specifically for women with PCOS. And then we grow the follicles with Femara, and then we trigger release of the egg, ovulation, with a trigger injection, and then we have you time intercourse based on that. We can also, I also would like to tend to recommend supplements like myo-inositol, which can help to make you more sensitive to the medications we give for ovulation. It can also help women with PCOS more likely to ovulate on their own. So that's a supplement that I would sometimes recommend to my patients with PCOS. In patients with PCOS who have diabetes or problems with, abnormal glucose breakdown, sometimes I'll also recommend metformin as well to help with that. Now, if all of these options are not successful, then we would talk about options such as intrauterine insemination or IVF as necessary. So, let's start at the beginning, because when you think about fertility, you need to start from the top. All women are born with all the eggs that they'll ever have. And as we get older, we are losing eggs all the time, even before our first period. And by our first period, we're down from 2 million to about 500,000 eggs. And we continue to lose about 1,000 eggs a month. Given that men are always making sperm, I think that Mother or Father Nature is biased. So if you think this is unfair, I agree with you as well. When you read about fertility in blogs or on the internet, there's this magical age 35. And it's not really that, at 35, you turn off a switch and boom, that's it, the lights go out. But really what happens is we are always losing eggs, and eggs are always decreasing in quality. And we know that that decline becomes quicker or faster at age 35. And so that's why we talk about age 35 being an important landmark for fertility. Now, what does infertility mean? Infertility is diagnosed primarily based on time. If you've been trying for a year and have not been able to conceive, then that is infertility. People always say, well, I didn't really try every month, and I did time intercourse every month. It really doesn't matter as far as the diagnosis, because the data that this diagnosis is from was not in women who were necessarily timing intercourse every single month. If you're over 35, however, we do recommend that after 6 months, you should have an evaluation for fertility. In general, 1 in 8 couples will experience infertility at some point while trying to conceive, and 1/3 of cases of infertility have a male factor component as well. So it's important for both partners to be evaluated. So at the end of the day, everyone's different. Everyone with PCOS is different. So there is really no one size fits all. Whenever you see your physician, they need to do a complete workup, and based on your evaluation, decide on what is the best next step for you. So what we usually will do here at Kindbody is we do a one-on-one fertility consultation. So you'll meet with me or with the fertility doctor in your location, and we start off with an ultrasound. And the goal of this ultrasound is to determine if your ovaries, if, for example, if you're coming in specific for PCOS, we want to see if your ovaries are PCO apparent ovaries, like I described earlier, because that's going to be part of the diagnostic criteria for moving towards a diagnosis of PCOS. We also do fertility evaluation. We check an AMH, which is a test of your number of eggs. It is not used as part of the diagnosis of PCOS, but it does give us additional information about your fertility in general. We will check your testosterone, like I mentioned earlier. We'll check your thyroid, screen for diabetes, and do all of the tests that I mentioned earlier in terms of determining if you have a diagnosis of PCOS. And then if you're in a couple and you're dealing with infertility, we always check a semen analysis as well, because even if there is PCOS, that does not mean there cannot also be a male factor process going on at the same time. Now, specifically to PCOS, like I mentioned earlier, the treatment options are ovulation induction, which again, I had gone into a little bit more detail earlier with Femara and Clomid being the two options that we usually will work with. If those don't work, then we can move on to IUI or IVF as needed. Now, but PCOS has a lot of non-fertility related symptoms. And so I am going to talk about those symptoms some more in the next few slides about treatment management options for those symptoms. And we do have options of nutrition, consultation, counseling, therapy services, and gynecological services for the non-fertility related symptoms of PCOS. So what are these symptoms? So the most common symptom that we will see, because it is part of the diagnostic criteria, is hirsutism and acne. So hirsutism, again, is hair growth in the male pattern. So in your chin, upper lip, upper back, upper abdomen, those are locations of hair growth that are very common in PCOS. There's also increases for diabetes, high blood pressure, obesity, endometrial cancer, as well as depression and anxiety with PCOS. So in terms of management of hirsutism and acne, the main reason for these symptoms are increased levels of testosterone or increased sensitivity to normal levels of testosterone. And so the treatment options basically work around decreasing testosterone levels as much as possible, as well as decreasing testosterone's activity as much as possible. And so typically the first step would be to try combined hormonal medications. And I say that and not birth control pills, because I think birth control pills is also a bad name. We use them for so many reasons, and they do help to sometimes restore hormonal balance. And so the combined hormonal medications, aka birth control pills, help to decrease your testosterone levels and decrease those symptoms that you're having from of hirsutism and acne. If that doesn't work, the next step is a medicine called Spironolactone, which some of you may be familiar with already. And that basically also decreases testosterone levels and decreases the effect of testosterone. And there are also non-hormonal options. So you could have laser hair removal. Usually with PCOS, the concern though, is that if the testosterone levels continue to be elevated, the hair growth will continue to happen even following laser hair removal. So usually you want to kind of come at it from two perspectives. Same thing with electrolysis for hair removal as well. PCOS is also associated with a higher risk of diabetes, high blood pressure, and obesity. The risk for diabetes and high blood pressure can be present even if there isn't obesity present. So, PCOS on its own is a risk factor for these. Krizsta is going to talk a little bit more later on about diet, so I'm going to leave that to her. But exercise can also be helpful with PCOS because that does help with, improved glucose metabolism, makes you more sensitive to glucose, and that also makes your ovaries more likely to ovulate in women with PCOS. And metformin is a medication that it makes you more sensitive to insulin. It's an insulin sensitizer. So again, it's coming in from the perspective of making you more sensitive to insulin, making you more likely to ovulate if you have PCOS. Metformin, however, cannot be used alone to cause ovulation. It's been studied and it's not very good at doing that. But when it's used in combination with other treatments, it can be effective for improving ovulation. PCOS has also been shown to have women with PCOS have a high rate of anxiety and depression. And so because of this, I tell my patients with PCOS that they definitely want to make sure they prioritize their mental health. And that they put themselves first. Support groups can be very helpful because you have a sense of community. I also recommend counseling services because that helps as well. Exercise is a really good way to help with anxiety and depression because it does boost your natural endorphins, and that helps with those symptoms as well. And so I just wanted to talk about some common myths people have with PCOS. One of them I already mentioned, which is that PCOS causes cysts. The answer to that, as we talked about earlier, is no. If anything, women with PCOS are less likely to have cysts compared to women who do not have PCOS. Another myth is that all women with irregular cycles have PCOS, and that is not true. As you mentioned, part of diagnosing PCOS is ruling out other possible causes of irregular cycles. So if you have irregular cycles, you do want to see your gynecologist or fertility specialist, and they can do a thorough workup, determine if you have PCOS or some other cause of irregular cycles. One thing I like to mention about irregular cycles is that if you're going 6 months or more without a period, you definitely want to see a doctor because the uterus is meant to shed every month. And so when you're going 6 months or a year without a period, that can cause abnormal changes inside of the uterine lining, and that needs to be evaluated by a gynecologist, which you can see a gynecologist with a kind body or your gynecologist that you see already if you're not in a location with a kind body clinic. And then you can also, another myth is that you can control whether or not you get PCOS. PCOS is a genetic condition, meaning that it tends to run in families. You don't get to choose if you want to have PCOS or not. And so having PCOS is like having any other medical condition where it is usually part of your DNA, kind of part of who you are. I like to give the example of how I have essential hypertension. It runs in my family. It's kind of just who I am. It's not something that I chose to get or got because I didn't eat right or did something wrong. So it's PCOS is kind of like that. It's not your fault. It is what it is, so there's no need to have any sense of guilt or shame or that you failed at something because you haven't. And then as far as the last myth is that you need fertility treatments to conceive. If you have PCOS, like I mentioned earlier, that is not true. There are women with PCOS who can ovulate on their own. And also, like Krizsta will talk about, there are changes you can make in your diet and your lifestyle that can improve the chances of you ovulating on your own and possibly not needing fertility treatment. I'm going to hand over to Krizsta.
Hi everyone, my name is Krizsta. I'm a nutritionist at Kindbody, and I'm so excited to be here today because PCOS is so common and it can be very frustrating. As Dr. Deborah said, it is genetics, dependent on genetics, and then it can get very frustrating because it has so many symptoms that can affect your life and everyday activities and everyday life, basically. But the good news is that there is a lot of things that you can do with diet and lifestyle changes to manage and to improve the symptoms of PCOS. So when it comes to diet and lifestyle, I always like to point it out that this is something that you can control. This is something that you have on your hand. This is something that you can always integrate in your everyday life and do it every day, and you will see improvements that way. So this can be accompanying medical treatment also, or you can just start off with dietary and lifestyle changes and see where does that take you, and then if it doesn't change things around enough, then you can seek medical treatment. And as it says it here on the slide, the very and most important thing with the PCOS is that really identify the causes of your PCOS specifically, because it's kind of very individualized how the symptoms shows up for everyone. And we want to make sure that we manage your PCOS symptoms according to what is driving your specific condition. So as I mentioned here, anti-inflammatory diet is very important because PCOS is an inflammatory condition and it can be driven by inflammation, or inflammation can be a symptom of it. So we want to make sure that our diet is anti-inflammatory, and I will talk about it later, and we'll give you examples of foods that can help, and then also what is can contribute to lowering the inflammation is a more holistic approach to this, and have regular exercises integrated into your life, and then also stress management, as Dr. Debo mentioned it earlier. And the other main drive of this condition, and also can be a symptom, is blood sugar imbalance that can show as insulin resistance. So first is basically you just have excess insulin in your blood circulation for a while, and then you develop diabetes. So you don't get diabetes overnight, but these are the steps to it. So first you have a blood sugar imbalance, and then you get resistant to insulin, and then eventually you might get diabetes. So we want to kind of start managing this at the early stages before you get to the diabetes part, and that can be very much helped with diet. So it's very interesting. I'm going to talk about all of the things that you can do and easy tips and tricks that you can incorporate in your life to help with blood sugar balance. And then also movement, as I mentioned, regular exercise. It doesn't have to be a crazy HIIT workout or marathon running all the time, but 15 to 30 minutes regularly, and it can be a low impact workout as well, and that will help with the in general with your metabolic health and cardiovascular health as well. And then stress management, also super important, and I can't express this enough. Sleep is very, very important, because of hormone production, and then your body to just function properly. Sleep is extremely important. So 7 to 8 hours of sleep per night would be ideal. So that's something to worth considering, incorporating into your life, and start practicing. And here are the best diet for PCOS. Let's talk about, so as I mentioned, I think the most important aspects would be focusing on inflammation reducing, and then focusing on blood sugar regulation. And what helps with an anti-inflammatory diet would be eat the rainbow. I'm sure you heard this 10 million times, but it's really true. The more diverse your diet is, the more diverse your gut flora is, and the healthier you are. So try to really incorporate all kinds of colored vegetables into your diet, and all kinds of textures. And then I also like to point out that both raw foods and cooked foods are very healthy for different reasons. So I always tell my clients to make sure that you eat both, because your body needs both. For the nutrients are just different in each way of preparing those foods. And then increasing dark leafy greens. I'm sure you heard that a million times also, but this is important for multiple reasons. These greens are very high in certain nutrients that are helping with inflammation. One of them would be folate, and then vitamin C, and then they are high in fiber and other phytonutrients that what basically do in your body is to help your body naturally increase the inflammation that might occur from insulin being increased in your body. So for example, excess insulin in your bloodstream is by itself already causing inflammation in your body. High testosterone levels can also cause inflammation in the body. So when I talk about anti-inflammatory diet, these are the things that you want to help to lower the inflammation from, because these excess hormones in your body cause the inflammation. And inflammation can be good in our body when we cut our hands, and then there is inflammation for healing the tissue and all of that. Those things, those are acute inflammation. But a constant inflammation in the body can be causing a lot of damage. And good quality fats. When it comes to this, I have a golden rule. What is good quality fats? So I think the easiest way to think about it is that everything that has been around for over 1,000 of years and is still using it has been proven to be healthy. And I think if you think about fats this way, it's always a good cheat sheet to have or a good reminder to have when you're shopping for it. So ditch basically all highly processed seed oils, and stick with what do we have for over thousands of years? Olive oil, extra virgin olive oil. We have ghee, which is a clarified butter. We have coconut oil, and we have animal fats, and also whole forms of fats. When it comes to whole forms, we are talking about nuts and seeds. We are talking about avocado, olives, and fatty fish, for example. So these are the fats that are very important to incorporate into your diet, because first of all, you need fats to produce hormones, and so it helps with the hormone balance, which you need it for brain health, and then also for your metabolism, it is extremely important. Also keeps you satiated. So then at the next slide, we're going to talk about blood sugar regulation, and I will mention how does fat help you with that. And then good quality protein. Here I say focus on fish and seafood. I would maybe suggest to lower the red meat consumption if you have PCOS. But it doesn't mean that you have to completely quit that, because it also has a lot of great effect on your body, like you need it for iron and you need it for protein. But I think focusing on fish, which has great quality fat, and then also good quality protein and other minerals and vitamins like vitamin D, which also helps with lowering inflammation, is very important. So when it comes to fish and seafood, I mean, of course, salmon, everyone knows that it is very healthy, but we have other fish like mackerel, we have cod, we have trout, which is extremely healthy. And then also when you think about it, these can be very expensive, but I always like to remind people that sardines and anchovies are great options for fish. They are great option for a great source of healthy fats and protein, and they are super cheap. So you can totally buy canned fish and please eat them, and it's inexpensive, and it's a win-win, I think. And probiotic foods. So probiotic foods you need because you want to make sure that your microflora is healthy and thriving. When it comes to probiotic foods, think about everything that is fermented and lacto-fermented. And here I'd like to mention to try to avoid sugary fermented foods like kombucha, because sugar can be highly inflammatory for your body. But we are talking about sauerkraut, we are talking about kimchi, we are talking about pickles, we are talking about yogurt and kefir, kvass, all of these probiotic foods that would be very worth to incorporate in your diet. And here, when it comes to these, I like to call these booster foods, because you don't have to eat a ton of these. Like you just eat a tablespoon of kimchi or sauerkraut with your meal, and that would give you the adequate amount per day for that day, or if you just eat that much of these probiotic foods. So don't think about it that this has to be like a portion of your meal. It could be just a little shot of sauerkraut juice or a kefir, or maybe one yogurt a day, to make sure that you have this in your diet. And then herbs and spices, these can be forgotten often, but they are very powerful. And as we all know, turmeric, ginger, and also green tea can be very helpful with inflammation. Turmeric and ginger and also green tea has been used for many centuries for the exact reason And you can cook with these, you can make teas with these, you can grate ginger on even on your salad, and it gives it a good spicy flavor. And then of course green tea, these days it's easy because matcha is everywhere, so make sure that you drink your matcha and make sure that it's not overly sweetened, because then we are not doing any good with that. And reducing toxicity, what I mean by this is that try to make sure to eat local. I like to use the acronym SOUL when it comes to this, which means seasonal, organic, unadulterated, and local. So this is another little cheat sheet when you're shopping. Make sure that you eat seasonal foods and local as much as you can to avoid GMO and other toxic exposure to your food, because that can also contribute to inflammation. And then next slide, we're going to have the blood sugar balancing diet. And this would be, so if you have afternoon cravings, crashes in the afternoon, if you overeat during the later part of the day, these can be signs that you might have blood sugar imbalance. And I'd like to point out that this is very easily manageable with diet and paying attention of how are you eating throughout the day and what is your meal consisting. So why I have this acronym, and this is my other golden rule, PHFF. This is, I think, the biggest help for all of my clients to keep in mind how your plate should be built. If you have protein, healthy fat, and fiber on your plate, that means that you have a complete balanced meal. This helps your metabolism to be on fire and work properly, and this helps for your blood sugar to not have spikes and crashes during the day. It will keep you full for 3 to 4 hours. It will give you and your body all the bricks, basically the building materials to function properly. So when it comes to managing a condition, always think about, so there are so many restrictive diets out there, and I always try to go against all of them because I want to add into our diet. I want to add foods. I want to advocate for adding foods, and always think about how can I support my body to function properly? What can I do? What can I give to my body to help it function properly? And not to take away things, but rather add. And I think this also helps with mentally to not just restrict all the time, but rather support and add and give. And focusing on these, as I mentioned earlier, the protein can be seafood, it can be any animal protein, it can be also plant-based protein. I'm talking about not overly processed Beyond Meat, but rather legumes and beans. And these are also high in fiber and extremely important for hormone balance. What happens is that fiber, for example, binds to excess hormones, and then it helps them eliminate it from your body. So you want to make sure that you definitely incorporate fiber into your diet. And then healthy fats we earlier mentioned. Think about whole forms of the fats, as it mentioned here, the food sources: olives, avocado, seeds and nuts, fish and animal fat, and everything in the store that comes in a see-through bottle and it's yellow in color, make sure that you leave it in the store, because those oils are probably rancid by the time you take it home. So I would suggest using the earlier mentioned old school oils and fats like coconut oil, ghee, and then extra virgin olive oil. And then the other tip that I always recommend to my clients is that try to forget about diets and fasts when it comes to managing a condition. This is the time when you want to support your body to get over these things and then help with healing. So in order for your body to be able to heal, you need to make sure that it has all the building blocks that I mentioned earlier. You want to make sure that it has all the material that it needs to heal itself. So eating 3 times a day in the regular times would be helping with that. And then it also helps with blood sugar balance. So what happens is that when you wake up in the morning, we got so used to not eating breakfast, but you wake up and then your blood sugar is low, and you want to make sure to support your body to have that blood sugar elevate just slightly and then drop slightly afterwards, avoiding spikes and crashes. And then that would be with a complete balanced meal that we mentioned before, like the PHFF, protein, healthy fat, and fiber. So think about 2 eggs and half an avocado and a bell pepper. Quick and easy. Eggs can serve as protein and fat. Avocado also serves as fat and fiber. And then the bell pepper would be part of the Eat the Rainbow and contributing with the color, high in vitamin C and fiber also, and other vitamins and minerals. So this could be a quick, healthy breakfast. Also, if you make your smoothie or make your oatmeal, just always keep in mind that you want to make sure to add all 3 into the smoothie or the oatmeal, because otherwise we easily can create a very high carbohydrate dish that is going to just spike your blood sugar and not help with the blood sugar regulation. And then also, if your lunch looks the same, then it's most likely going to help with not having the crash later, because what happens is that if your blood sugar was elevated earlier, then when the insulin comes into your body and takes care of all that sugar in your bloodstream, then your blood sugar drops, and then you suddenly low energy, and then you need a quick fix. And this is when we snack on things that you might going to regret later, or overeat towards the end of the day, which can also, this is when these things can contribute to weight gain with PCOS besides the hormone imbalance. So eating 3 times a day and eating every single time a complete balanced meal would be very beneficial. And as I mentioned earlier, avoid dieting and fasting. This is the time to heal the body. This is the time to support your body to function properly and heal properly. And eventually, when you feel better, you can incorporate intermittent fasting and things like that. But for women, mostly because we go through so many hormonal changes during the month, it's very hard on our bodies to fast. And there are many studies coming out recently that proves this. So be careful with those things. And then the next slide, we have what to avoid. And as I mentioned, sugar is highly inflammatory. So all kinds of sugar, especially added sugar, I would suggest to avoid. And if you use sugar, make sure that you use whole forms again of sugars like honey or dates or coconut sugar, because even though those are also sugars, at least they have micronutrients involved, like minerals and vitamins in them. So it gives a little more than just a blood sugar spike. Often, this can be a misconception that dairy and gluten should be avoided right away if you are diagnosed with PCOS. Not necessarily. If you can tolerate it, then obviously yes, but you can play with this around, and this is when nutritional consultation comes in. Having a support and having a curated plan specifically for you would help with this, to experiment if you can still keep dairy and gluten in your diet, and you don't have to give up things that you might really much like. Alcohol, also because it increases hormones, specifically estrogen and testosterone, and then also because a lot of alcohol is sugar, so the same applies. Refined flours and refined oils are also highly inflammatory, and it's just empty. The refined flours would be just empty carbohydrates. And then when you hear that PCOS, people with PCOS should eat a low carb diet. Not necessarily true, but it does apply for refined flours, because these are just empty calories that cause inflammation, and then it just goes through your body, spikes your blood sugar, and does more harm than gives you benefits. And on the next slide, we will talk about the misconceptions, as I earlier mentioned. So one of them is weight gain is the main cause of PCOS. It's kind of tricky and more complex than that, because hormonal imbalances can cause weight gain. Also, extra weight can cause hormonal imbalances. So it's a back and forth game, but it doesn't have to be the very first thing to focus on in order to manage PCOS. But the good news is that if you lower inflammation and if your blood sugar becomes regulated and balanced, then naturally your body is going to shed the extra weight, because all of those symptoms and conditions, like the inflammation and the blood sugar imbalance, cause weight gain, and it causes weight gain because the fat storage, but then also it retains water, so you are more puffed and edemic. And if you try to fix your diet, and if you start incorporating whole foods into your diet, then you're most likely going to reduce that. And as I mentioned earlier, gluten and dairy, not necessarily if it's not tolerated, but having the help of a professional, nutritional professional could help you with experimenting and figuring out what would be the best diet plan for you. And same goes for low carb. It's another misconception. And then anyways, carbs are just such a wide concept. Like, we have carbs, but fiber is also a carb. So this is when it comes to talking to someone who knows about these things and can explain it to you, and then can talk about food in a way that you actually understand how can you help your body the most, would be extremely beneficial. And what I always tell my clients is that if you focus on fiber, for example, it's like one of the easy steps to incorporate, and forget about carbs and any other things, but just focus on fiber for now at the beginning, because it's so good for your body, and then it gives you so much benefit that it's just easier than thinking about the whole big concept of carbs and good carbs and bad carbs and all of those things that are so trendy these days. So here I say focusing on carbs that are high in nutritional value. I mean, whole grains, for example, they also high in fiber, but then also high in vitamin B and all kinds of minerals that are extremely important for hormone balance and hormone production. Resistant starches, think about, for example, if you cook potatoes and then you let the potatoes cool, then it becomes a resistant starch. When the potatoes are warm, they are just simple starch. So simple starch becomes sugar in your body, but resistant starch, if you eat it cool down or reheat it, then it becomes a resistant starch in your body that can help with your microbiome. So just these simple tricks, same goes with rice, by the way. Simple tricks would help you navigate all this information, and then quickly implement healthy choices into your diet. And then also sometimes you might be told to not to eat fruit if you have PCOS, but that's again not true. We have amazing berries and amazing foods that are very high in antioxidants, which are anti-inflammatory, and they must be part of a healthy diet. So definitely would suggest to focus on berries and focus on yes, low glycemic fruits, but also keep in mind to eat seasonal. Right now, the peaches are in season, watermelon is in season. So I wouldn't suggest to eat a persimmon right now because it's not in season. So always keep in mind that that is the healthiest choice for you, and with moderation, it's absolutely fine. So these are just in a nutshell my thoughts on how diet can help with PCOS, but keeping in mind to lower the inflammation and most importantly, balance your blood sugar levels is extremely important in managing and improving PCOS symptoms and getting your life back basically. And I think that's it from my part. And then I'm gonna give it back to Amandalene. Yes.
Yes, thank you so much. That is very helpful. We have a ton of questions here. So let me just quickly wrap up this presentation for you guys. We, Kindbody, we're here to help. So in addition to our fertility and gynecological services and care, we do offer nutritional consultations, wellness, and therapy services. So we are here for your whole reproductive health journey. You can, if you're in Austin, you can see Dr. Debo. You can make an appointment with Krizsta, who is, she'll meet with anyone virtually. Also, she is, thank you so much, Krizsta, for joining us. She is 1 month postpartum with a new baby. So we appreciate you taking the time tonight, but we are here for it all to address everything PCOS related and not. We are all over the country and quickly expanding. So we're in New York, LA, San Francisco, Atlanta, Austin, Denver, opening up Minneapolis, and lots of exciting new places coming in 2022. So stay on top of that. Hopefully coming to you wherever you are soon. We do, I'll get into a little bit of the pricing and then we'll hit the questions quickly. We do accept insurance. If your health plan does not take insurance, we will take out of pocket. So tonight, thank you everyone for joining us. We do have a discount for you guys. So if you are interested in booking a fertility assessment, which is what Dr. Debo kind of walked through, we use the code PCOS 2021 for 50% off your assessment, and then also some discounts on the egg freezing, IVF, if you guys choose to move forward with the cycle. And now I'm gonna stop sharing my screen and let's get into some questions. I was taking notes here, so let me just grab my phone. Dr. Debo, this one's for you. Can your standard OBGYN diagnose PCOS, or should you be going to a fertility specialist for PCOS?
Yeah, so an OBGYN should be able to diagnose PCOS. PCOS is a diagnosis that can be made by a gynecologist or by a fertility specialist. And so if your OBGYN is board certified, then they should be able to diagnose it. So, that's definitely an option as well. Now, if you're thinking of trying to conceive with PCOS, I do think it doesn't hurt to speak to a fertility specialist at that point in time, just to make sure that, everything that needs to be considered is being considered in terms of moving forward with fertility. We're trying to conceive.
Yeah, thank you. You mentioned birth control as a treatment, but I've been told that birth control can cause infertility. I know the answer to this one, but I'll let the expert take it.
Okay, sounds good. Yeah, so birth control does not cause infertility. And actually, once you start taking birth control, you are fertile again as little as the following month. Sometimes the first 3 months after you stop the pill, you may have, some irregularity, but that will resolve within 3 months of stopping the pill. So it does not cause infertility. There are many benefits to birth control pills. Again, birth control is a bad name because we use them for so many different things.
Great. Are there any other health risks I need to know about if I have PCOS?
Yeah, so I think the only thing that I mentioned very briefly was that if you go very long periods of time without a period, then there is that increased risk of cancer in the lining of the uterus. That's called endometrial cancer. So that's another reason why if you're having irregular cycles, you do want to get it checked out. You don't want to just ignore it and say, oh, I'm just happy that I'm not getting a period every month. You should only have irregular cycles if you're on medication to cause your cycles to be irregular. So if you don't have a medical reason for your cycles being irregular, then it needs to be checked out. But I think I mentioned everything else in the presentation. Someone did ask about miscarriages and PCOS specifically. Yeah. And so, traditionally people will mention that women with PCOS have higher rates of miscarriage. The data show that the rates of miscarriage and PCOS are similar to other women with infertility. So women with infertility in general have a slightly higher risk for miscarriage, and that's the same whether the diagnosis is PCOS or something else.
Yes, thank you. That was going to be the next one I threw your way, so appreciate that. Can you ovulate without your period? And if so, can you track that?
No, if you've ovulated, you should have a period 2 weeks later, within 10 to 14 days of ovulation.
Right. And so if you are not, if that's something, come to Kind Body, we can do a full workup. Do you suggest getting a full hormone panel once being diagnosed with PCOS?
Yeah, so part of the diagnosis is a hormone panel. So, when people ask me about a hormone panel, I'm never 100% sure what they're asking for. If they're asking kind of for what I recommend as a hormone panel, or I always joke that we're all on Instagram, so we all get these ads. And I'm like, as a doctor, I'm like, should I check my cortisol? Like, I know I shouldn't, but like, they're so convincing. So in terms of like the hormones that are actually used with the PCOS diagnosis, we check the testosterone. We will sometimes check a DHEAS depending on your symptoms. We also check your thyroid hormone. We check something called 17-hydroxyprogesterone, which is another hormone that can cause irregular cycles. We check for diabetes, which is a way to measure insulin indirectly. We don't actually check insulin levels. That's really the workup. And then also we sometimes will check a hormone called prolactin. That's done as part of your PCOS evaluation. And so if you're being diagnosed with PCOS, those tests have usually been done already.
Great, thank you. A few people, and this is a question I have too, a few people have mentioned lean PCOS in the comments. What is lean PCOS?
Yeah, so lean PCOS, there is a misconception that all women with PCOS are obese, and that is not true. And you can definitely have lean PCOS, meaning that you meet the criteria. You have the increased hair growth or acne, you have irregular cycles, your ovaries are PCO appearing, but you don't have the symptom of obesity. Now, in terms of, the management, it's pretty similar across the board. Both lean PCOS women who have, weight management issues with PCOS all have increased risk for diabetes and high blood pressure. And someone had actually asked about high cholesterol. That can also be increased in PCOS. That's present in women with both lean PCOS as well as obesity with PCOS.
Great, thank you. Here is a specific one. I've been taking birth control pills for almost 10 years. I'm planning to try to start a family in the next couple of years. Is there any data on higher risk of PCOS if one is on birth control for a long period of time?
No, it's not related at all.
Great.
And someone asked a question about 17-hydroxyprogesterone, and I think I might not have been clear. 17-hydroxyprogesterone is not a test for PCOS. It's not related to PCOS at all. It's a test for a completely separate genetic condition called congenital adrenal hyperplasia that can present with PCOS-like symptoms. And so whenever we diagnose PCOS, we always check that hormone just so we know that we're not incorrectly diagnosing PCOS when there actually is something else going on. So it's a standard part of the workup for PCOS.
Thanks. A few people have asked this, but can you heal PCOS? Can you heal PCOS, or is it expected to just change as you age? Can you kind of like outgrow PCOS?
Yeah, so as far as PCOS symptoms, the irregular cycles tend to get better as we get older, not because of anything that you do, but because we have fewer eggs and there's less of that. Basically, we think of it as an ovarian resistance to ovulation, and that decreases as the number of overall follicles decreases. You can't really heal PCOS. You can improve your symptoms, like Krizsta mentioned, with your diet, with exercise. And again, kind of going back to my example of having high blood pressure, I'm never going to not have high blood pressure, but I can manage my symptoms with diet, exercise, medications, but you're never necessarily going to be PCOS free, so to speak. So it's kind of like a way of being, and you have to kind of manage your diet, your exercise, your lifestyle around that.
Thank you. Let's get a few more. Krizsta, this one's for you. How would you find out if you have a blood sugar imbalance? As
I mentioned earlier, if if you have afternoon crashes or you tend to overeat towards the end of the day, that usually means that all day long your blood sugar was up and down, up and down, up and down, and then by the afternoon it's low again. So you need a quick fix, and this could be one. Also, if you just in general, if you have a sedentary lifestyle and then your diet is a standard American diet, then you most likely have blood sugar imbalance because all of those things contribute to that. But also, we kind of train ourselves to not to listen to our bodies. And how I said that we tend to skip breakfast these days because it's very trendy. We actually turn off certain hormones like the satiating hormone or the hunger hormone this way. So eventually your body doesn't even know what it's doing at this point. So it's very hard to tell. But if you just generally start to eat this way and then make sure that every meal that you have is a complete meal, then you definitely helping your blood sugar to be balanced during the day, even if you don't have those symptoms. And anyways, you can only benefit from a whole food diet that has all these main components that we need for our bodies to function.
Thank you. Dr. Deborah, back to you. Can you speak on the relation between PCOS and a patient's response to egg freezing, since they likely have more follicles?
Yes, I can. So typically women with PCOS will have more eggs, which is good because with egg freezing or even with an IVF cycle, you want to have more eggs. So that's typically the case. Couple of caveats though is one, women with PCOS are at increased risk of over-responding to the IVF medications. This is called ovarian hyperstimulation syndrome. And it basically means that while you get a lot of eggs, and while that is good, on the other side, your ovaries are overstimulated. That can make you feel a little bit uncomfortable for about 7 to 10 days after your egg retrieval. And an egg freezing cycle is not a problem because it will resolve on its own. In an IVF cycle, we recommend that you freeze all your embryos, give your ovaries time to cool off, and then do an embryo transfer. Oh, and then, sorry, one last thing too, and some may have talked about this or asked something else about this as well, but the other thing with egg freezing is that sometimes with PCOS, we do have a higher percent of eggs that are of poor quality. And so although you get a lot of eggs, you don't necessarily have as many embryos developed from those eggs as you would expect in someone who does not have PCOS. So that's another concern that we have with egg freezing or IVF in women that have PCOS, is poorer egg quality.
Oh, that's good to know. How does PCOS interact with endometriosis? Are people likely, are you more likely to have endometriosis if you have PCOS and vice versa?
Yeah, so as far as the data that we have, there is no connection between the two, but you can definitely have both. But they have pretty different pathophysiologic processes.
And then one thing we didn't get into too much detail about, but are there any suggested or recommended exercises for people with PCOS? Either one of you, feel free to answer, jump in here.
Yes, so as I said, don't think about crazy heavy exercises. You don't need to break a sweat. What you want to do is boost your metabolism, and that comes from building muscles. So a low impact weightlifting workout, for example, would be much more beneficial than jumping around like a crazy person. So think about 15 minutes, especially starting out. Don't go overboard, just 15 minutes of weightlifting. And that can be something at home. You don't have to go to the gym. You don't have to start on crazy weights. I'm talking about, especially if you're starting out with, like, you can use a gallon of milk and leave that, or anything in your house that is heavy to start out, but you want to go slow and you want to make sure that you're working that muscle. So I'm also not talking about pumping like how we see it in the TV, but rather really focusing on that muscle group that you are working and then going slow to work that muscle, so you are actually building muscle, because building muscle helps you basically helps you burn fat even when you are not active. So you want to make sure that you have more muscle in your body, so you constantly, basically this is what it means when I say boost your metabolism. even when you are not active, your body is in a burning state. And then also think about just walking could be also really good for the metabolism. This is not building muscle. It's not that type of workout, but rather on a cardiovascular level, it would be very beneficial for your health and also boosts metabolism. Walking, swimming, these type of workouts. I know these are not so trendy, but they can be great. But also if you feel like it, sure, do a HIIT. It's great for you too. But I'm saying starting out and, just go slow and low. And then these could be very, very great for PCOS.
Great. And I am going to end it on a high note, but it's a question about load libido. So are people less likely to have do you have a lower sex drive if you have PCOS? A lot of people have that question.
Yeah, so that has actually been shown that women with PCOS do have issues with lower libido. It's not clear why. So it's not clear if it's the testosterone levels or if it's more to do with, something like the insulin levels. So we don't know why that is, but that is something that has been noted in women with PCOS. And typically implementing, lifestyle changes and also working with a therapist can help with the low libido. That's been shown to be beneficial for low libido PCOS.
Great. Okay, we're going to wrap it up here. Thank you, everyone. Please, if we didn't get to your question, go to the Kind Body Instagram. We have our most recent post is a quote from Dr. Debo. Drop your questions there. We'll get through and answer all of them for you. Thank you guys so much. Again, if you go to book an appointment, the promo code is PCOS 2021. And a few people asked this question. We will be sending around the recording. It gets posted to our YouTube. But if you are RSVP'd for this event, you will get an email tomorrow. We'll have the details on how to book an appointment. Use your promo code, a link out to tonight's recording, and share the information on how to book a nutritionist appointment too, if that's what you're interested in. So thank you guys so much. Krizsta, Dr. Debo, thank you both so much. And you guys stay tuned. We have some other exciting PCOS awareness events and educational information and blog posts that are coming out over the next few weeks for PCOS Awareness Month. So stay tuned. Thank you guys so much. Thank you. Thank you.